Hi, my name is Jamie, and we are the physical therapists with Nevada Advanced Pain Specialists.
And I'm Kelsey, so I'm at the Sparks Clinic. Today we're here to talk to you about why physical therapy would be a great idea for you and why our physical therapy is a little bit different than what you may have heard of from other providers.
So physical therapy is a great resource for anyone, basically. You can be in pain or you can even not be in pain, especially the way that we do manual physical therapy. If you have back pain, neck pain, headaches,
or even
pain.
If you just want to preventatively avoid being in pain, if you're an athlete, if you just have balance issues, anything to better your function and decrease your risk of hurting.
We do a lot of hands-on manual therapy, so we want to identify if people are not moving very well, if their posture is off. We work through restrictions, we do myofascial release and joint mobilizations.
Pretty much we use our manual therapy techniques to improve the restrictions and the dysfunctions that we see, and then we like to teach you how to move better so that eventually you don't need us and just use us for maintenance.
I think people come in and they think of physical therapy as just exercise. So they're expecting to come in and only do exercises, and people are going to watch them do exercises, and it already hurts to move, right? So why would I want to exercise and make my pain worse? But with the manual therapy, and I don't think people really understand manual therapy. They'll say, I ask them, hey, did you get manual therapy at another physical therapy clinic? And they say, oh yeah, somebody, messed with my knee for a little bit and then I did my exercises. Ours is more body work. Is I think that how people can really relate to it is that we do so much hands-on. Our techniques that we use are great for chronic pain because it's so gentle. A lot of times I think people actually leave here thinking, okay, she didn't even really do anything. How am I going to feel better? And they come back the second time and they're so shocked. Okay, what exactly did you do? Because I felt so much better and I felt like you didn't even do anything.
The things that we don't really realize are connected with our structure and how we are built and how maybe we've been thrown off with our alignment and our posture and how much that affects throughout our entire system and our entire body, even emotionally. So I've had a lot of people that once we start working with them, all of a sudden, their mood improves because their function is improving. So that's really fun to watch as well.
So our exercises that we start out with, especially the fact that we work in a chronic pain clinic, they're very easy. We usually want to focus on mobility before strength. So a few key stretches and a few key strengthening exercises, and then we try to build off of that. We really try to focus on making sure that the exercises do not create excess pain. Now, sometimes when you haven't moved for a little while, you're going to be sore. But for the most part, we're not going to get you doing a CrossFit exercise within the first couple weeks.
And really, a lot of the times what we want to teach you is how to move in the comfort of your own body. So like Jamie said, avoiding pain as we can, but also finding that threshold and that limit to where a little bit of pain might be okay to get you to be moving better, so that you don't think that everything that you do has to hurt.
Okay, so Kelsey, why don't you talk a little bit about how we are doctors of physical therapy, so we do have the ability to diagnose and know when it's appropriate to treat someone versus when we should be able to refer out to an orthopedic surgeon or pain management or some other sort of physician.
Absolutely, that's a really good point. We do use a lot of special tests and diagnostic measures to look at you as a whole and to decide when things are in our realm to be able to help you move past those restrictions and move a little better, or when that restriction is coming from a different place that maybe is out of our realm. Maybe you need surgery or an ablation to help what we do. It's very common to work together with our pain science side to use those techniques to decrease pain so that we can then get you moving better and more effectively.
And sometimes we need to refer out for an MRI, say for a shoulder problem. We can a lot of times identify, is there a torn muscle? Is it a partially torn muscle? Is it a tendonitis, a bursitis? Special tests can tell that. We actually have quite a bit of knowledge in that. And there are times where we can turn around and refer out after the first session and say, let's go get an MRI because you might need surgery. Versus, no, let's try this, let's try some conservative therapy, and if after a couple weeks you're not getting better, then you can go see your orthopod.
So Jamie, what are the top conditions that you usually treat here, and maybe a couple good ideas of ones that you've had really good results with?
So I mainly see low back pain and neck pain, I would say, is very common in the chronic pain realm. Of course, I also see shoulder pain, ankle pain, wrist pain, you name it. We can treat all different parts of the body. However, things that tend to respond really well to physical therapy is going to be if you have muscle weakness, we can strengthen. If you have muscle tightness, we can lengthen. With joint restrictions, we can do manual therapy techniques to break through those joint restrictions. So if it's a musculoskeletal structural problem, a lot of times physical therapy is going to help with that. Now, if we have a nerve pinched, that can be difficult to deal with sometimes by utilizing joint mobilizations and myofascial release and things like that. Sometimes we can release the pressure off that nerve. However, if it's coming from more of a structural anomaly, like a bulging disc or stenosis, things like that, we may not be able to completely eliminate the pain, but we can maybe improve range of motion and decrease their pain in conjunction with the pain management side. What about you? What have you seen on your end?
The ones that I've seen really good results with are SI joint dysfunction. Because of the techniques that both of us use, both the myofascial release and the muscle energy technique, I've had a lot of really good success when people have that pinpointed pain. I'm going to show you right here. So a lot of the times, a couple sessions and people instantly come back and say, man, you know, I've never had PT like this before, but whatever you're doing is helping because now I can move and I don't have as much pain. Look at this range of motion, now I can touch my toes. And it's based off of, you know, a couple of easy manual techniques that are very gentle and pain-free, and then some nice easy exercises to kind of hold that structure that we're trying to help along and get back into a better position and alignment. We really focus on what your goals as a patient are, not necessarily what I think you should do or what Jamie thinks you should do. I mean, we'll throw our opinions in there, but definitely what you want to get back to doing. Do you want to get back to cleaning your house without pain or being able to pick up your granddaughter or walk your dog? So we like to hear what your goals are and then get you back to those things as well. All right, well, thank you so much for joining us today. I hope you learned something from us and got some questions answered. Coming up next is a video on Aging and Awesome where Jamie shows one of our patients, Joe, how to stretch and move and be a little better and pain-free.